Okay, looks good. Alexis, thank you. You know, many older adults struggle with a lot of the same stressors as young folks do. I'm joined now by Dr. Shagun Sagar from SSM Health to talk a bit more about the topic. Welcome to Wellness Wednesday.
Thank you. Thank you for having me.
Good to see you. Okay, so let's talk about how common depression is in older adults.
Well, one thing I want to share is that, you know, depression is not part of getting older. And so in the general population, there's less than 5% of older adults that have depression. And 12% of patients who are in the hospital or have been hospitalized have depression. And 15% of patients that have chronic illness have depression.
Dr. Sagar, how is depression maybe a bit different in older adults? I think a lot of times, you know, older folks might say, oh, I've lived a long life. This is just who I am, where I am in my life, and that's all it's going to be. Just talk about the differences.
Yeah, so it is much more common in older adults, for sure. And the other thing is that it's misdiagnosed a lot because physicians and patients feel that it's part of getting older. And so they think that is just the normal trend, but which it's not. Depression definitely can be, treated. So patients who are older adults have a better life.
Maybe kind of a no-brainer question, but why is it so important to treat depression in older adults? It's not just young folks, but, you know, older folks too.
So I think it's also about quality of life. So patients have a lot of symptoms that can affect their quality of life. And I think, you know, it does affect their, activity levels, being more social, if they have, symptoms of depression. So I think it's very important to treat the depression so they have the max amount of quality of life.
You just mentioned some symptoms. Now, if you are maybe a caregiver or you have a parent who you think might be struggling, what are we looking out for?
So I think the biggest thing is, there might be a restriction of how physical the patient can be, but I definitely think encouraging your loved ones to be more active, but definitely I would say have them, see their physician before they start doing things that maybe would harm their body. The other thing is some, older adults are resistant for a change. So I think we need to respect that. We can always encourage and support them, but also know that some of these older patients are set in their ways, and so they might not want to do the changes.
And if you or a family member is struggling, how do you reach out? What do you do?
So I would definitely, go to the appointments with your loved ones and, and talk to their primary care. We also have, palliative care service in SSM, and we take care of patients who have serious illnesses, and depression is one of the most common symptoms that we treat for our patients. So any patient that has a serious illness, older or younger, we are more than happy to see them. We help with symptom management. We help with goals of care, making sure that the treatment aligns with their goals.
You know, it really gives insight on a very important topic, as we know. Thank you so much for being with us.
Thank you for having me.
Okay, we'll be right back after the break. Stay with us.